We're discussing today changing condition. This can be an improvement or a decline. It is our duty as caregivers, med techs, supervisor to notify MD, family, and legal representatives of any changing condition. And you want to think, what is a changing condition? This can be a UTI, a fall, any kind of trauma, sudden confusion or lack of mobility, change in eating, drinking, weight loss, stroke, infections, wounds. It is our duty that we ensure that we are providing residents safety and well-being. And it is essential that when things are noticed, that they are reported. And that is, the earlier the better. This is to avoid more serious health problems, unnecessary visits to the ER or hospital. Identifying when there is a change in condition, there are some things that can provide us with guidelines. One that is very simple is to know someone's baseline. A baseline can be determined by when a resident is admitted into a facility, there's an assessment done, a reassessment, even just meeting with that resident. You want to know what their usual level of functioning is. Things that you want to understand: how well do they express? How well can they perform their ADLs? Those are baselines that we can determine. You want to observe level of alertness, their cognition. What is normal for that person? You want to make a note of usual abilities and habits. And things like pain. Is there chronic pain? Is there acute pain? Have there been falls, or is this a first-time fall? You want to look at psychological factors, mood, reactions to stress, control issues, things that are going on after an illness. New baseline needs to be established when there are changes like that. So a baseline can be established, and when there is something that has gone on, we then reestablish a new baseline. So the things that you want to look at, we like to do a head-to-toe assessment, and as caregivers, the easiest thing is to start with the eyes and the ears. You want to look at physical, mental functioning, emotional functioning, social function, and changes in needs. When you are reporting anything, you want to make sure that you are always following your facilities, policies, procedures, and guidelines. You want to always report to your supervisor. That would usually be your first line of reporting, but it is many times necessary. You can gather a lot more information if you're also talking with other staff. Over-reporting is nothing wrong with that. That's always better than under-reporting. As we know, with older adults, it's less obvious when there sometimes are a change in condition. The things that you really want to look at are in behavior: anxiety, depression, aggression, agitation. Those are things that you definitely want to report. Any wandering, falls, weight loss, weight gain, infection, any new pressure injury, abdominal condition, any nausea, vomiting, and diarrhea, pain, any new meds, change in their level of ADLs, or truly any cognitive changes. Always good to, like I said, talk with your other staff and family members of the resident. Sometimes they are the ones that has the instinct that something's wrong, and you can gather a lot of information that way. Some of the causes in changes conditions: that you would maybe want to think about would be a medication change, new medication, a reaction to a medicine, an illness, constipation, infection, dehydration, cognitive problems, stress, psychological problems, and number one, UTIs. Medication side effects, they can sometimes mimic disease. So when we aren't finding something right away, you can think that. And then also, you never want to rule out normal aging, but you also don't want to not report something thinking that it is just normal aging. Some of the things with drug reactions, signs can be fatigue, diarrhea, constipation, incontinence, depression, weakness, dizziness, drowsiness, and then always pay attention if they've had any new medications. That would be discussing with med techs. You want to look at drug, and drug-food reactions. Something to consider. Even over-the-counters can cause things like that. Conditions that increase the chance of a UTI would be diabetes, the aging process. We know that what is most common is our little old ladies have UTIs quite frequently. Things that can cause a UTI would be a problem emptying your bladder, and things that can affect the problem of emptying your bladder would be kidney stones, enlarged prostate, immobility, bowel incontinence. As a UTI that's not treated quickly can go into kidney involvement, and things that you'd want to look for would be chills, confusion, a temp greater than 101, someone complaining of side back, flank, which is in the back, or groin pain, reddened skin, nausea, vomiting, or abdominal pain. Many times UTIs are overdiagnosed and overtreated. We still want to report anytime we see these conditions, and it should always be ruled out. Falls, when you see someone that has had a fall or maybe had two falls, you always want to think, what is the change of condition? Is there something happening that has caused this fall? Causes of falls can be trip hazards, medical side effects. With your vision, cataracts, macular degeneration, leg, foot, and problems and swelling, and no feeling, neuropathy in the lower extremities, orthostatic hypertension.